Managing and treating essential thrombocythemia, or ET. The goals of managing essential thrombocythemia, or ET, are reducing the risk of blood clots and bleeding, preventing heart attack and stroke, managing any symptoms, and helping you maintain a good quality of life. You can work with your healthcare team to create a treatment plan that fits your specific needs. The right treatment depends on several factors. Your doctor will assess your risk for blood clots based on your age, whether you've had any before, and whether you have certain gene mutations like JAK2, CALR, or MPL. Doctors group ET into risk categories. Very low risk means you're under 60 with no JAK2 mutation and no history of blood clots. Low risk is under 60 with the JAK2 mutation and no clots. Intermediate risk means you are over 60 but do not have a JAK2 mutation or blood clots. High risk means you are over 60 with a JAK2 mutation and have had blood clots. Your risk level helps determine the best treatment. No matter your risk level, healthy lifestyle choices are important. Regular exercise, healthy weight, a balanced diet, reducing stress, and not smoking all help reduce the risk of blood clots and improve your overall health. It's important to manage any other health conditions that raise your risk of heart problems and blood clots, such as high blood pressure, diabetes, or high cholesterol. One ET treatment is low-dose aspirin, which helps keep platelets from sticking together and forming clots. Aspirin can also relieve burning or tingling in your hands and feet, which some people with ET experience. However, if your platelet count is very high, over 1 million, your doctor may not recommend aspirin because it can increase your risk of bleeding. Medications called cytoreductive therapies are another option. They help reduce the number of platelets your bone marrow makes and can help symptoms. Cytoreductive therapies include hydroxyurea, which is a medication that slows down how quickly your bone marrow makes blood cells, including platelets. You take it by mouth, and your doctor adjusts the dose based on your blood counts. Your doctor might prescribe anagrelide to reduce platelet production if hydroxyurea doesn't work well or causes side effects you can't tolerate. You take anagrelide as a daily capsule. The dose is adjusted to keep your platelets at a safe level. It can affect the heart, so may not be a good option if you have heart rhythm problems. Pegylated interferon helps control blood cell production in a different way. It's given as an injection you can do at home. This treatment is considered safer or preferred when treatment is needed during pregnancy, so it's often used for younger patients or women who are pregnant or planning to become pregnant. Over time, a small number of people with ET, about 5 to 10 out of 100, may develop a condition called post-ET myelofibrosis, where scar tissue builds up in the bone marrow. If this happens, your doctor will talk with you about different treatment options, since management for myelofibrosis is different from ET. No matter what treatment you receive, regular checkups are essential. Your healthcare team will check your blood counts, blood pressure, and cholesterol levels. They will also check for signs of an enlarged spleen and make sure your treatment is working well. It's also important to track your symptoms over time so you can notice any changes. Tell your team about any new symptoms right away. Researchers are developing new ET treatments. Talk with your doctor about whether a clinical trial might be right for you. Organizations like the MPN Research Foundation and National Cancer Institute have information on available trials. Living with ET is about more than just your blood counts. Your treatment should help you feel better and do the things you enjoy. Tell your doctor if you have fatigue, difficulty concentrating, or other symptoms that affect your daily life. You may need additional support or an adjustment in your treatment. With proper monitoring and treatment, many people with ET can live long, full lives. Stay informed about your condition, work closely with your healthcare team, and remember that you're not alone on this journey.